Hello, my name is Justin Clark, and I work with Adolescent Health Working Group, a nonprofit organization based in San Francisco, California. We are a coalition of youth, caregivers, and adolescent providers in the public and private sectors, and we seek to increase the capacity of service providers to better support youth ages 12 to 24 by offering providers training opportunities, innovative resources, and direct community engagement. This video interview series is to help inform folks on the variety of ways that nonprofits and public agencies and providers support the health and safety of young people. And as an organization dedicated to bringing folks together, Adolescent Health Working Group will use this series to help elevate and share the voices of experts, leaders, and young people. So today we are very excited to have Sasha Simon as our guest. Sasha is the Safety First Program Manager at the Drug Policy Alliance, and she manages the development and evaluation of the US's first harm reduction-based drug education curriculum for 9th and 10th grade students. Sasha, thank you so much for joining us today.
Thanks for having me. I'm super excited to be here, super excited to speak to my work and also all the ways in which the Adolescent Health Working Group has been super supportive of that. So I appreciate the opportunity.
Wonderful. So just to kind of help us get started, can you explain a little bit more about what Safety First is?
Yeah, definitely. So Safety First, Real Drug Education for Teens is a harm reduction-based drug education curriculum for 9th and 10th grade students. It's designed to be taught in 9th and 10th grade health classes by a health teacher because that's the ideal grades to really inform teens about some of the topics that we tend to deem to be more riskier or where they're engaging in more risky behavior like sex and drugs. And ideally teaching them these topics when they're in 9th or 10th grade, you're giving them the information and the skills that they need to be able to have good decision-making skills and know what resources and what rights they have before they're either introduced to the opportunities to get engaged and make a few mistakes. So Safety First is really cool because it's based in harm reduction. Most drug education throughout all the decades is based in abstinence, which is essentially saying that you're never, ever, ever, ever going to do drugs. And yeah, Justin, I don't know about you, but I had drug ed back in the 90s and I was a DARE baby. Did you have DAREs as well?
I did, yes.
So you know the deal, right? So it was, I think we had like 2 police officers who came to elementary school. They were like in 4th or 5th grade. And they were like, drugs are bad. People who do drugs are bad, right? So you learn the stigma very early and you don't want to be in trouble with us. So I'm going to need you to pledge right here and right now to never, ever do drugs, to never become one of these people that I'm going to lock up, and to never be one of these people in the commercials whose, brains are frying in the frying pan. And all of us said yes, and we pledged yes, and we got the t-shirt that said, drug abuse resistance education, and we also took that pizza party that they gave us too, because why not, So that was many millennials, and that was many Gen Xers drug education. And so I was being a little facetious, but not all that much about, what DARE actually looks like or what it looked like in the 90s, because it's very important to know that that is the totality of what a lot of people know about drugs, and that has shaped the sense and really kind of like the framework through which people speak about drugs. So when you're thinking about drug education, you're also thinking about drug policy. Think about who are policymakers and who are teachers right now, right? They are also the people who have been DARE babies and, receive that type of messaging, as well as, politicians who are having to decide, well, what is fair, equitable, and reasonable drug policy. But it's very difficult to, to vote in that direction if you're miseducated around what drugs are, who drug users are, and even what effective treatment is. So Safety First we saw as this incredible opportunity to really change the game and give teachers a resource and a tool that they can use to have a different way and have better language and have a system with which they can have a harm reduction based approach in their classrooms. And hopefully we have a more educated and also a lot more compassionate generation that's being raised that has a much better solution for, drug use than just criminalizing people, and really just criminalizing Black and brown people for drug use. And that's really the system that we live in now.
So, kind of due to COVID-19, some parents and caregivers are taking a more active role in their child's education. And a lot of these folks who are the millennials and Gen Xers who were dare babies kind of grew up or kind of experienced that abstinence-based drug education, and may kind of be at this point in which they're learning that that is not the healthiest option for young people. So can you explain a little bit more about kind of why that is, and why health educators kind of focus on harm reduction now?
So that's such an excellent question. COVID-19 really has humbled a lot of us across the board, and it's really allowed us to not take a lot of things for granted. I think for parents, it's really allowed them to see the breadth and the gravity and the detail of the work that teachers do day in, day out, and really appreciate that. And it's also been humbling because we've all had to learn new forms of either working or learning and helping other people. And so it's been this great, I love the learning and I love the learning experience in general, because you have to be humble and you have to be open. And so COVID has put us in this moment where we have to be humble and we have to be open about learning new things, be it how to learn online, or even how to access the healthcare system while being at home, while knowing that there's, an infectious virus out there, and how do I navigate that? So we're all having to learn new things. So that's just a great period. On top of that, on top of the kind of technical aspects of it, right? We are all having to learn a bit more compassion as well. Ideally, we're learning a bit more compassion, and we recognize this moment as a shared and collective moment of crisis, and also of trauma. And we recognize that it's impacting people across the board. And so people are going to need to cope in different ways. And so we're seeing, a greater organization and a greater push and a greater promotion of mental health resources, so people know that that's available and accessible to them. But we're also seeing more people accept the fact that young people have something to cope with. Typically, when it comes to coping and how we speak to young people about the concept of mental health or mental illness, we speak about it in terms of if, whether rather than when, right? If you have some issue where you might need some mental health support, maybe here's where you can get it. It's not an if. Life is hard and it's gonna, knock you on your butt sometimes, and it's all good. It's a matter of when, and when it does happen, here's consider what are the best resources and what are the best skills to be able to cope. And this moment has been a great moment to finally recognize that people use drugs to cope. And there's a myriad of different reasons that people use drugs to cope. It can be coping from physical pain. It can be coping from trauma. It can be coping from, and so right now is such an awesome time to actually have a very honest and serious conversation with your teen, because they may choose to use drugs to cope. And is it really worth tough love right now? Is tough love a really fair approach? And also when they return to school, is that tough love, zero tolerance approach going to be what's best for your students as well? And so right now is an incredible opportunity for everyone across the board to really reframe how it is that we engage with people who are doing any kind of help that we don't like, or coping in any type of way that may not be the best, and be more compassionate, meet them where they're at, and guide them towards a better way. So that's what this opportunity really gives parents right now during the COVID crisis. And I feel like this entire moment is kind of based in harm reduction. We have no choice but to meet people where they're at. I mean, we could choose not to meet people where they're at. We do see that to some respects here in the US, which is kind of sad. But if we are actually going to be effective, and if we are going to step up to the plate and, really make this better in any way and across the board, we have to meet people exactly where they're at. We have to be okay with what we see. And I think that abstinence-based approach made it not be okay with what we saw. We made drug use not be okay. We made drug users not be okay. And what we ended up doing is, we really created a prison industrial complex around that, around to make those type of people just disappear. But again, this moment is a great moment to really recognize that there's a lot of reasons why we cope. There's a lot of traumas that we experience throughout life. There's a lot of reasons why we use drugs, and punishing people and stigmatizing people and pretending that people don't do these things, or only bad people do these things, or only Black and brown people do these things, or we do it at a higher rate than white people do, which is untrue. It's a great opportunity to really break all of that apart. And so I'm grateful for all the work people are doing to really bust those untruths right now, because they're in our face.
Yeah. So I think one of the things that I'm familiar with that is being done right now that kind of break those untruths is you're the host of a web series called First of All, which provides harm reduction, drug education for teens and teachers and parents. Could you share a little bit more about that?
Yeah, absolutely. So I'm super grateful to be able to do First of All. It's a live stream web series. So we go live every Monday on Facebook and YouTube. It was created in partnership with a mental health foundation called Made of Millions. And Made of Millions is incredible because a lot of their work is around democratizing access to mental health resources, and also creating platforms for advocates to be able to speak more to their work. So what was provided to me by Made of Millions was a platform to be able to speak to the why of Safety First. What is the context for why we created this? So for years, as it was being created, we had piloted Safety First in New York and San Francisco. We've evaluated it. We were very much in the research in development phase of it, which is great, but it's very difficult to explain to the general public like why they should care about all this research, and why we work so hard to vet it and be evidence-based and driven. But now that First of All is a 7-part series, we can speak to the different topics, right? And kind of more broader themes as to why you need to reconsider, or why we need to reconsider our approach to drug education and drug policy more broadly. Because again, at least last year, accidental overdose was the #1 cause of death in the US. And still, overwhelmingly, we've been pushing this just say no, you're too cool for drugs, only losers are drug users kind of stuff, while we know that many families are dealing with the loss of, and grieving the loss of their loved ones, and are coping with, or trying to manage and, assist and support loved ones who might have problematic issues with problematic use. And that's just not the reality that we're living in. And so we've got this very hardened, kind of sense of how we're supposed to deal with drug users and what drug policy should look like forward, right? Not just can you do drugs or not, but what does your school's drug policy look like? What does your work's drug policy look like? Will you be criminalized for drug use? There's so many different systems, and the Drug Policy Alliance is doing a great job to show all the different systems that are being impacted by drug policy. It's not just can you do drugs or not, but is what agency do you have to your body, and the decisions that you make based on what space you're in, how is that going to impact your future? How is that going to impact your education? How is that going to impact your employment? And is that worth it? Does it actually help you? It doesn't. It doesn't help to criminalize anyone. It doesn't help to isolate anyone from their community or their families. In fact, folks who are actually locked up for drug use, I think they're up to 40 times more likely to actually experience an overdose once they're released from prison. So it actually exacerbates your overdose potential by being criminalized. So across the board, we see how it doesn't work. And First of All, it's been an opportunity to really tease all of that out and really speak to the multitude of ways in which we've done ourselves a disservice by teaching really young children, young people lies about life and about reality, and how we have yet to be able to really tease out that contradiction yet. But right now, you know, in a public health crisis, it's a great opportunity to do that.
Absolutely. So, you know, you have kind of the live stream series that's going, and in the midst of this public health crisis, I know there's a lot of health educators who are trying to adapt to this sort of the new education setup and kind of remote learning and all of the challenges that come with that. So do you have any recommendations for health educators who may be trying to kind of, yeah, figure out the best ways to handle some of these things?
Oh, so that's a great question. I think at this moment it really goes both ways. Right now, I'm really having to rely on the expertise and the technical skill of teachers and learn how to learn what technologies and which tools are best for them to use based on the types of assignments they want to have. So in real time, we're working to adapt safety first so that it's more accessible for Google Classroom use. And we're relying completely on teachers to make sure that looks best. So I would say to teachers that they have a lot of power, a lot of authority, and a lot of expertise in this moment that's really needed. And they should not hesitate to share it. And I hope that other organizations will take the opportunity to really lean into it and to request it. But another tip that I would offer, I mean, Safety First is available online. And I am already aware of some teachers who have downloaded it as is. It's meant to be taught in classrooms, but they've downloaded it as is, and they've been able to adapt it as they need to for distance learning. But I mean, honestly, I would take a look at some key activities that are around really breaking down stigma, promoting harm reduction, promoting, destigmatizing mental health and accessing mental health resources. I think those are going to be the key things that health educators can really do, is really remind and really instill those health-seeking behaviors into young people, especially right now that they're at home. And I mean, we all have to figure out how to deal with the healthcare system remotely, or you're only going to go in person too, and that's fine. So adults are having to do that. You should learn how to do that too. There's no, you're involved in this too. And so there's some really good not new, these are standard health skills, but right now is really the time to make them applicable. And so any activities that practice that, I think, and destigmatize that practice of seeking those health resources, I think right now are key.
Great. So how can folks get more involved with the work that the Drug Policy Alliance is doing, and how can they view, first of all?
Well, first of all, it's the easy one. It streams, it streams live on Mondays. We actually have our last episode this coming Monday, May 18th, at 12 p.m. Eastern, 9 a.m. Pacific. But that's not the only drug resource that we have. We actually have a pretty dope suite of drug resources beyond just Safety First, beyond First of All. We also have a Drugs and Stuff podcast. We have new episodes every Wednesday. So that's a really cool way to stay up to date with the work that we're doing, and also any updates in the world of drug policy, especially during the time of the COVID-19 pandemic. We also have a COVID-19 and drug policy webinar series that actually premiered last week. And so that's another way to stay in tune with all the work that we're doing. If you're a teacher and you're looking for some teaching resources, Safety First is always great. We also have this really cool Matters of Substance animated video series. It's these 60-second video clips that explain really complex, I don't think, they won't be complex once you look at them, but more complex drug policies so people can get an idea of what's really going on here and really get to the heart of it. So we have a ton of resources. Of course, another great way is to donate. All of these drug education resources that we provide are completely free of charge, and DPA relies completely on private donations to make all this happen. And, you know, we're really proud of what we're able to achieve, and we're really proud of, you know, how we've been able to step up and meet people where they're at, even in the midst of, you know, a health pandemic. So donating is also a great way to stay involved and make sure that we can continue to innovate and do the things that we enjoy doing.
Awesome. So the final question for you, We are currently recording this during a kind of stressful period of time due to COVID-19. And so I was going to ask if there's anything that you are especially enjoying right now. It can be a book, an album, a TV show, just anything that is lifting your spirits.
Oh man, what is lifting my spirits right now? I mean, there's so many things. I'm watching a lot of TV. I'll be real about that. In the past, I haven't really gotten to, but it's been such a great opportunity to really be able to binge watch what everybody's been talking about. So honestly, that's been fun. Now that I'm home, I love cooking. My partner and I love to cook. And so it's been a challenge. It's been a fun challenge to come up with new things to cook and taste it and see how it goes and be okay with it not being well, because there's plenty of time for next time. Um, and yeah, and I like to take short walks every now and then too, and just get out. And I like to write as well, whether it be my feelings or some poetry, and then I also make a point to speak to my therapist on the regular as well, just to make sure I think I'm sane and I think sure I'm maintaining, but it's good to get some feedback too.
Awesome. That is great. Thank you for sharing that. And thank you for joining us today. We appreciate your time and opportunity to learn more about your work and the incredible programs that the Drug Policy Alliance is working on. And as a reminder for everyone, if you'd like to learn more about the Drug Policy Alliance, please visit drugpolicy.org. And we will also include links in the description of this video. So thank you all for watching. Wishing you all good health and take care.